I'm Abby Walker, and in this video I'll be demonstrating a dry clean dressing change, and I'm going to let you view my surroundings right quick. And then I'm going to go ahead and get started. So one of the first things you want to do, you want to verify your physician orders, gather up all your equipment. You want to identify your patient, their name, their date of birth, any allergies they might have. So I'm going to wash my hands and put on my clean gloves. And then with my clean gloves on, I will be able to remove my soiled dressing. And whenever you remove your dressing, you want to kind of grab it by the edges and roll it away. So grab it, roll it away, out, and you want to dispose of it into biohazard. And I'll take my gloves off, and I want to wash my hands again and put on some new gloves. And while doing that, I want to assess my wound, my incision, and you want to look for any signs of infection or the color, any exudate that there might be. And then I am ready to open up my gauze. You want to open it away from you, like that. And I'm going to take out some of the dry gauze, put it sort of on the lid to be used for later. Then I have my sterile saline. You grab it by the label, flip it, and pour it over some of your dry gauze to make it wet gauze. And I would label my saline after I had opened it. And now I am ready to clean my wound. You get your wet gauze and you make a kind of little fold. I'm going to go on the incision first, top to bottom, throw it away after each pass because you can only use it once. And again, I will make my little pocket by the corners and go top to bottom on the next side, throw it away, make my little pocket, go top to bottom on the last side, throw it away. And then I'm going to dry it in the same way, make my little fold with my dry gauze down the middle, top to bottom, make my pocket to the side, top to bottom, throw it away. And then one more time on the last side, top to bottom, throw it away. Then I'm going to get my dry gauze, put it over my wound. I'm going to get my dressing. I have my name and the date that I changed it on here. So I put that on. I want to tape it. I only have 2 pieces of tape, but you would tape all around. And that's it. So you have done your bandage, you take off your gloves, you wash your hands. Then I would document the procedure. I would document any observations I made, like the drainage, the color, location. And then you want to, of course, document their response, the overall response of the patient. Last, I'm going to be talking for a minute about different types of drains and dressings. So your drains, you have your closed and open. A closed would be like a Hemovac or a Jackson Pruitt, and that kind of like pulls off the drainage. And then an open would be like a Penrose. As for different types of dressing, you of course have your gauze, can be dry or wet. It's inexpensive to use. You have a transparent dressing. It's used to like visualize the wound, but you would never use that if it was heavily exudating. Your hydrocolloid, you have a hydrogel and an alginate. The hydrocolloid is used, it pulls out moisture, like absorbs, I mean, and then your hydrogel, it adds moisture. And then last, your alginate, it is used for like a heavily exudating wound. And that's all I have. Good night. Have a good day.